Hello, I'm Lauren Workman, and today I'll be providing you with some information and ideas about sharing data and findings with communities. But first, I'll tell you a little bit about myself. I'm a research assistant professor in the Arnold School of Public Health. I have a joint appointment with the Core for Applied Research and Evaluation and the Department of Health Services and Policy Management. Most of my work focuses on the use of qualitative research methods, program evaluation, and health systems transformation. Most of my work is focused on healthcare utilization and access, maternal and child health, and community-based health promotion. To get started, let's talk about a few reasons that it is important to share data and findings with the community. One reason is to use the information you've gathered to inform the public about an issue. You could share this information to increase awareness about an issue, to motivate people to take action about an issue, or to engage a group of stakeholders around an issue. For example, think about a public service announcement on drunk driving. You might report information like, last year, 100 people were killed by drunk drivers. We can change this and do better this year. Secondly, when you share information and findings with the community, you want to make it meaningful and actionable, but you have to be strategic in the way that you're sharing the information to ensure that it's relevant and will resonate with your target population. Another important reason to share data and findings is to take the information you've gathered and translate or use the information to take action. You can think about what you could do at the next step based on the information that you've gathered. Other reasons to share data and findings are to share what you've learned with other scientists and public health practitioners, to build and sustain good community relationships, and to help secure future funding and develop partnerships with funders. Overall, sharing data and findings is an integral part of community health development, and we should think about sharing the data that we collect from the start of a project or initiative. Some things to consider when planning the process to share data or information include, what do your stakeholders want to know? Stakeholders may include program staff and implementers, decision makers, including funders and policymakers, program participants, and maybe your research or community collaborators. You'll want to engage your stakeholders and ask them what is important and the types of information that they need to guide decision making or take action in their community. Also, you always want to keep in mind the overall purpose of your project, evaluation, or research initiative. This will guide the questions that you ask and the methods that you use to collect the information. You'll want to be sure to answer these questions when you report the information back to the community or other stakeholders. Third, you want to consider what the intended users or target audience will do with the information and the best ways to deliver the information to those specific groups. You'll need to remember here that different groups, users, or target populations may have different needs or uses for the information. Therefore, you might need to tailor the format in which you share the information or data to several different audiences within your stakeholder group. Lastly, you'll want to consider how the information will be used. For example, is the information being shared to incite action among policymakers, a community coalition, or another group? Or is the information being used to influence someone or something? For example, community health assessment information can be used to influence decisions about resource allocation in the community. In community health development, it's always important to consider how you will engage stakeholders throughout each step of the process. When thinking about sharing data and findings with the community, you can think about this in the planning stages as well as in a data dissemination phase. In the planning stage, you want to work with your key stakeholders to determine how the findings could be used, to identify the primary users of the findings or information, and to help develop a reporting and dissemination plan. When the data has been collected, you can engage your key stakeholders in reviewing findings and interpreting the data, helping to prepare or report the findings, and assisting in developing potential recommendations based on the information you've collected. You always want to work with your key stakeholders to determine the overall content and format for information sharing. There are many steps in the community health development process that are appropriate opportunities for sharing information. Some of these include when we have conducted and completed a community health needs and assets assessment, when we need to set priorities among a stakeholder group, when we're starting or implementing a new program, when we have finished a program, and when we're thinking about ways that we can sustain our program or initiative. With that background information, we will now move into some specific tips related to sharing information with the community. Our goal should not be just to generate a final report, but rather it should be to share information that a group or community can use to make decisions and/or take action. So we should ask ourselves and our team members, what is the best means to communicate what we want to communicate to a specific target audience or our intended primary users? First, you'll want to consider the most appropriate methods of communication with your specific target audience. We know that each community is unique, and it is very important to understand the context of that community or group and tailor our communication strategies to the needs and preferences of that group. Therefore, it is important to work with stakeholders to determine the most appropriate, preferred, and commonly used methods of communication. For example, do people prefer written or oral communication? Or would the data or information resonate with people more if it were delivered in a story format rather than a traditional report? As I mentioned earlier, you always want to think about the target audience for your information. You may have several target audiences based on the scope of your project or initiative or the size of the community. You want to think about who is going to use the information. For example, are you providing this information to your funder, to program participants, or to policymakers? The way that you format and deliver the information to each group may vary significantly. An analogy to think about. You may not describe your public health interests to a potential employer the same way that you would describe them to your grandmother. We always tailor our messaging based on who we're communicating with. Again, you want to consider the different questions that different stakeholder groups may have and how that information will be received and used. You may consider developing a communications plan that outlines each target population, the information that they need, the best format to deliver that information, and who will be responsible for developing and delivering that information. Finally, you want to make sure that the information is readable and understandable, as well as appropriate for the intended audience. So, you'll need to consider what's culturally appropriate, you'll need to consider language barriers, and you'll also need to consider literacy levels. When thinking about literacy and comprehension, you want to consider the audience's experience and familiarity with the subject, and if they have the appropriate context to fully understand the information. You may need to tailor language to a different level or work with a translator to translate information into another language. It's very important to consider those that have visual or hearing impairments as well. For example, if you are reporting information in colorful bar charts, a colorblind individual may not be able to fully understand the information because of their impairment. I'll share a few more thoughts or points related to health literacy. It is always important to consider health literacy levels, and specifically health literacy when sharing information with the community. Health literacy can be defined as the capacity of an individual to obtain, interpret, and understand basic health information and the services needed to make appropriate health decisions. Many health documents are written at or above a 10th grade level. Think about this the next time you look at a brochure with information about a health condition, read information about your health insurance, or receive information packet with your prescription medication. There are several things that you can do to meet the needs of low literacy populations. For example, if a written report does not seem appropriate or stakeholders have stated that it's not their preference, you could consider developing a video, a podcast, or some other communication method. Again, you always want to engage your stakeholders in the process of sharing information, so remember to always ask them for their feedback and/or pilot test an early version of your video or report to ensure that it's clear and understandable. Involving the community in the development process will really help to enhance cultural, language, and literacy appropriateness. If you're developing written materials, use a simple layout and design that includes a good amount of white space. Also, use plain language and avoid jargon or medical terminology. If you must include jargon or medical terminology, remember to give an explanation in plain language. It's a good idea to limit your document to 3 key messages and use graphics to illustrate your messages. Use a font size that's easy to see for older eyes. And lastly, always remember to check the readability or reading level of written reports that you're producing. Microsoft Word has several tools built in that can be used to quickly and easily assess the readability of a document you're developing. There are a variety of formats that can be used to share data and information. Written formats can include short documents like executive summaries, or just a one-pager that describes a few key messages or findings. In addition, stories are a great way to communicate data or information and can be more appealing to some populations. Dashboard reports have become more popular in recent years. A dashboard report typically is a one-page graphic that presents information in tables, graphs, and charts. Depending on your target population, verbal or electronic delivery formats may be a better fit. PowerPoint presentations are an option, but be sure not to fill your slides with lots of words or read straight off of them. You'll also need to be sure to engage your audience. Community panel presentations, town hall meetings, or data debrief parties are also great ways to share information. They're also very valuable in that they typically generate discussion around interpretation of findings and can even lead to the development of recommendations about what to do next. Other formats to share information include websites, webinars, podcasts, and social media. The use of social media has exploded over the last several years. There are specific guidelines provided by the Centers for Disease Control and Prevention for sharing information on social media. There are best practices for many forms of social media, including YouTube. After this lecture, please take some time to review the links provided on this slide and these social media guidelines. Finally, here are a few formatting tips for developing a report. These are generally related to developing written reports, but the framework or structure could be translated to developing verbal or electronic materials as well. Your report should include some background information on the purpose of the program or initiative, some detail about how the information is intended to be used, and the program or initiative's stakeholders. Remember, when describing how the information is intended to be used, you want to consider if you want the reader to take action or if the report aims to influence someone or something. You may also consider including background information on the community to provide context on the setting and/or issue to be addressed. You'll also want to include some information on your methodology. That is, the questions that you set out to answer and the techniques that you use to answer those questions. For example, if you asked a question, what are the assets and needs in the Richland County community, you may have used interviews and a windshield tour to gather that information. For most reports aimed at community members, this methodology section should be very simple and brief. Your report should also include key findings from your data. You'll want to make sure that this information is presented in a way that's very easy to understand. For example, if you're reporting results from a survey, consider using graphs, tables, and/or charts to describe the results rather than a block of narrative text. You should still include a short description with each table or figure, but your visuals should clearly communicate the findings. Lastly, your report should include recommendations and lessons learned. You'll want to describe how the information could be used for further action or decision making, and what else could be done with the information. It's also a great idea to include community members and other stakeholders in the development of recommendations. Recommendations should be feasible, realistic, actionable, and tailored to the intended users of the information. Again, it is important to involve or engage stakeholders in interpreting results and developing recommendations. This will increase the likelihood that your findings are contextualized in the larger scope of the community. For example, you may have conducted a survey that identified vacant space in communities as a primary concern to the community. You may follow up with a listening session or community meeting to discuss the meaning of that data within the particular community. It's also a great idea to review results with stakeholders before completing or submitting a final report. This will help to ensure that information has not been misinterpreted and that community stakeholders feel comfortable with the way that their community is portrayed. You may consider sharing a draft report or scheduling a meeting to review the results. This is particularly important if you have unexpected or puzzling findings. This can also go a long way in creating trusting relationships with your community stakeholders. So, we've covered a fair amount of information. The key take-home points for sharing data and information with communities are as follows. Always engage stakeholders in planning for data collection, as well as in the process of sharing and interpreting findings. Remember, one size does not fit all, and you'll need to develop different communication formats for each segment of stakeholders. Hosting sessions to process results with community members and to develop recommendations will help to ensure that community members feel that their voices are being heard. As we discussed earlier, you should start planning for reporting and communicating information from the beginning. Remember to ask people how they would like to receive information and tailor your communication techniques to their desires. Lastly, remember that you may need to communicate information in a variety of ways to ensure that you meet the diverse needs of your community stakeholder population. Thank you very much for your time and attention today. Go forth and do good.